Good afternoon. I want to call back into session the Sacramento County Board of Supervisors May 23rd meeting and thank those who've joined us for the afternoon session. We were a little delayed in getting started. The morning session ran quite up against the 2 o'clock hour, so we like to start just a little bit late this afternoon, but appreciate the patience by those that are here, and we still have several items to complete this afternoon, maybe have a little bit of gaps in time. We'll see how that goes, but with that, I'll ask Flo to please call the roll, establish a quorum, and we'll get started.
Okay, Supervisor Cerna?
Here.
Kennedy? Peters?
Here.
Frost?
Here.
Natoli?
Here.
And you have a quorum.
And I might just mention for those I did mention this morning, but Supervisor Kennedy is not joining us today. He's attending a conference relevant to the Sacramento Transportation Authority and his regional transit duties, so he'll be back with us when we come into session tomorrow, as I understand it. So, all right, we'll go ahead, and I think we're going to call a little bit out of order, but certainly with the same grouping of items, and I'll leave that to Flo. Go ahead.
Okay, so we're taking up item 81, which is the Child Protective Systems Oversight Committee 2016 Annual Report.
Okay, and I know we've got our presenter. I'll invite him down and certainly reintroduce himself. I know you were here last year, so you have had at least 1 year in doing this. And we just said that we want to make sure we got the report before we responded to it, so I think take this in the correct order, so at any rate. Good afternoon.
Thank you for having us here today, and we really appreciate your time. I'm going to introduce myself because normally the chair of the Children's Coalition do that, or the vice chair, but they're tied up with their respective organizations with semi-emergency situations, so they couldn't be here. So I'm Maynard Johnston. I'm a pediatrician, retired now. I've been a pediatrician for over 40 years. I've been on the Oversight Committee just shortly after it started in 1990. It started in 96. I joined in early 97, and I've been on it since then. I've been the chair intermittently, and most recently as of the first of the last year. So,
well, and thank you for your service, Maynard. That's a long tenure and certainly a very serious business, and we appreciate certainly your representation of the body, certainly the body of work, but thank you for your service too.
So the PowerPoint slides just are a small part of the report, and you have both the PowerPoint slides and you also have the full report. So we'll go through this because time is of the essence. So here's our committee membership, and you're certainly welcome to peruse that at your leisure. And the history, it was established in 96, as I mentioned earlier, by you folks, different members of the board, of course. Came as a result of a severe case of child abuse that happened around that time, 96. That was a boy by the name of Adrian Conley was severely mistreated. And so this committee came out of that. It provides systems oversight, not just child protective services oversight. And it's also, as I mentioned, a committee of the coalition. And in small print, you can see page numbers, and that references where they can be found in the body of the report. So introductions, page 6, presentations, the full wording that comes out of the presentations to the Oversight Committee on page 7, and then on 10 for the follow-up of the 14 and 15 recommendations, then our recommendations on page 24, and then our work plan for this year on page 7 or 24 or 25. Sorry. So our focus this year. We recognize that Sacramento County is not the only agency that is responsible for the safety and well-being of children. A more unified effort among these agencies can strengthen the safety net. Children and families in our community often have contact with multiple agencies At the same time, we invited several agencies and departments to share what they do so that we can better understand their role. The agencies included and this is on page 7 through 9, and Appendix C, the Sacramento County Sheriff's Department, the Sacramento City Police Department, the Sacramento County Department of Human Assistance, specifically CalWorks, the Sacramento County Department of Health and Human Services, Division of CPS, and also Division of Public Health, same 7 through 9 Appendix C. And we had presentations from the Child Death Review Team and also the California Alliance of Child and Family Services. Our recommendations for this report, our 2016 report presented in May of 2017, which are on page 24, these are 1 through 3, and we'll go through the other slides. And these come as a result of observations that we gained during our meetings and investigations. One is to provide the emergency hotline that CP has with public health nurse resources. They have some, they need more though, which could assist with determining response times and conclusions on referrals with allegations of medical neglect and staff training around these resources. That is the PHNs. To assign a PHN to every case that meets criteria, utilizing all on-call contract or registry nurses to fill gaps as needed, to develop the resources to allow PHNs to follow at-risk medical children after the cases are closed with CPS. Currently, PHN services to family and children cease once the CPS case is closed. And over the years, the Critical Incident Subcommittee has reviewed cases where referrals with allegations of medical neglect were not adequately assessed. It is recognized that social workers do not possess the training or expertise needed to assess the risk factors that medical conditions present. Having PHN resources available to social workers staffing the emergency hotline room and providing training around how to best utilize these PHN resources would be beneficial.
Maynard, if I could just ask you on that one. So
Sure.
Has that previously been called out? Do you recall in any of the reports that, is that kind of a repeat maybe or a positioning of a previous recommendation?
Yes, we recommended it last year, and we did get some support from the board.
Right, okay.
So we appreciate that.
Okay, got it.
But you're right.
Yeah, but we've seen that before. Okay, thanks. Appreciate it.
To fully staff the child abuse bureaus of law enforcement agencies, and as an example, the Sacramento County Sheriff's Department, their Child Abuse Bureau used to have 10 detectives on their staff, but this was reduced to 7 during the county budget cuts in 2009. And so no new positions have been restored since that time. An additional detective would be very helpful to alleviate the workload that has developed. Provide additional mandated reporter training for the DHA, that's the Department of Health Assistance staff. The committee has a concern that due to the low number of referrals to CPS by DHA, they are mandated reporters, there appears to be underreporting of suspected child abuse that they encountered, so we're hoping to have that addressed and corrected if it is indeed a problem. And we also last year mentioned the idea of a blue ribbon panel that the board would support members from law enforcement, human services agencies, district attorney's office, probation, et cetera. You can read it so that they can identify gaps and other solutions for this complex problem. This panel would mirror a similar panel that was approved by the Board of Supervisors addressing the disproportional rate of deaths among African American children. So we're asking again for support in that area. The Board of Supervisors request that CPS ensure that stronger drug and alcohol policies are put in place. Again, it's similar to a recommendation we made last year, and that CPS has the resources needed to evaluate caretaker substance abuse. That is, they have adequate training, that there's ready access to testing, that there's consultative support, and that caretaker substance abuse is elevated to high risk when formulating the safety plans. With the recent passing of the California Proposition 64, which is the marijuana legalization initiative, CPS reports that they will review all policies and procedures and ensure that all staff are trained and policies, including those including visitation, are aligned to address marijuana and its safety. The Oversight Committee will continue to advocate for stronger drug and alcohol policies. 8 is, again, a return of a recommendation that dependents of CPS have the same level of intervention attention as being afforded to the commercially sexually exploited children, or the CSEC population. And this recommendation will continue to be a prime focus on our Oversight Committee. That CPS completes their work on policies and procedures and submits a timeline to the Oversight Committee. The policy and procedures issue has been a long-standing concern of this committee, and this will continue to be a prime focus of our committee. To make these policies and procedures available on mobile devices and to create the ability for staff to participate in online interactive trainings. Now, the board enabled CPS, what they did this last year enabled CPS to purchase software for their PNPs. During the a presentation by the DHA, the Oversight Committee learned that DHA already has technical solutions in place that could address the needs of CPS. So we're going to see how that collaboration works out. 11 is...
Excuse me, Mr. Johnson. So on that one, you said you understand there was already software available, even though there was somebody was proceeding ahead with trying to purchase it?
Well, I think that will be addressed by the department on their response to our...
So we think we had it, but we didn't know we had it, so we were going to do something else, but now we're not?
The DHA has systems in place that might be of benefit to CPS, and apparently it sort of came out when we had our meeting with them, and so that's being looked into. Okay. And then they'll also address the putting in place these hardware and software issues that the board approved funding for. Again,
I know that Michelle or Dr. Heller or somebody will be talking in a moment, but I guess I'm curious because when we last, a few years ago, had some very serious issues arise, and obviously some situations that, got community attention and certainly the attention of this board. And, we had consultants who were here before us, and obviously the CPS Oversight Committee was involved in those as well. But there was recommendations to make sure that we had, in-field devices that would be available, that we'd have, the training in place, we'd have mobile devices, and then that was a bit slow to roll out if I remember right, but it was making sure that the folks in the field, had the proper training, and had the tools that they needed to help them both back return to the office, but also as they were working cases. And this seems to me to be just a continuation. I understand the online interactive trainings, that may be another piece of this, but I guess either from the committee standpoint or certainly from our staff, I guess I'd like to know, because I remember that time after time in these chambers, we talking about when we were working on policy upgrades, and I even saw that in here as well, that we've done 30 policy revisions and we got 100 and something left to do, and it's taken us X amount of how many years to do those. Maybe it's just been a year, but it seems to me that some of those things have been recommendations that have been on the table for a while. I guess I'd ask you first, Mr. Johnson, kind of what the committee's view of that, and obviously staff will have a chance to respond. But as I was kind of comparing the documents here, the recommendations and the responses, and kind of thinking back historically over the last half dozen years or so, it seemed to me that some of this has been on the docket for many years now.
Well, every year, so that would be a good observation, and that's why it continues to be, because as DHS will mention, they are dealing with it again, and so that'll be a continuation of our work for next year to hold them to the fire, if you will, the feet to the fire to get these things done. And they mentioned in their response, and they should address that, what they are doing, and they do have a timeline now. And and there are issues that came up, such as losing staff that were doing policy and procedures. They had to be taken during the crunch of the, but they can address that. But you're right, it's been an issue every year. So we're hoping that now, this year, things will finally be, you'll see some, by next year's report, we'll hopefully be able to report that things are moving along finally.
Yeah, made some strides. Again, it's not just to do it to be doing it, but I think it certainly helps provide the level of support, and obviously, hopefully the training behind that goes with the experience for folks that are working some very difficult situations all the time. So, okay, thanks.
So 11 is that CPS continue to focus on domestic violence and progressive intervention. It's been, I've been involved with critical incidents almost from the get-go, and a significant number of them, either directly or indirectly, involve domestic violence, and it's hopefully starting to starting to be realized, the severity that domestic violence does to families and to children. And so we want to make sure that this issue of domestic violence is taken very, very, very seriously and dealt with appropriately. And recommendation 12 is the call center issues. That is, we want decreased wait times, we want consistent use of SDM hotline tools, and reviewing evaluated out dispositions. And SDM is structured decision making. Nothing really has changed with respect to this since our 2014 annual report, and this will be a high priority for the committee in the coming year. The Oversight Committee will monitor progress in decreasing wait times, consistent use of SDM tools, and that there's a more in-depth review of cases that have been in the past evaluated out. So our work plan for 2017, meet with the ombudsman person and review her work, and we've done that already. We are going to continue to receive CPS updates. We're going to continue the critical incident case reviews. We're going to follow up on these 16 annual report recommendations. We're going to meet with the medical neglect review team, and that's scheduled for July. continue to collaborate with the Child Death Review Team, develop collaborative efforts with agencies that serve children, such as CCS, California Children's Services, etc. And our CCS is going to be integrated with our Medical Neglect Review Team presentation in July, and then possibly investigate around the California Child Welfare Corps practice model, how it's being implemented in the county. Our prime focus for next year, you saw our work plan, but our focus will be a review of the 2016-27 critical incidents. As you'll note, we really don't talk much about them. It has to do with the time frame. We wanted to get our report before the board earlier this year than we did last, so that was less months. And we wanted to focus on collaboration this year. But next year, the majority of our report will deal with the review of our cases, critical incidents from 16 and 17. Also, which isn't on the list, we want to get involved with restarting the report card that Sacramento County used to have. It used to come out annually or biannually, and there hasn't been a report card for several years now. So we are going to at least try to get that started again as best we can with our committee. We also, I know this is a huge topic, but to deal with homelessness, and one of our committee members in education works in the Twin Rivers district, and she says in her district alone, and it depends on how you define the problem or what's a homeless person, but they have 2,500 children that are homeless just in the Twin Rivers district. So we want to get a little bit involved with that. We may not delve into it or have the time, but at least get started. Also, the Sacramento County Medical Society has taken a big interest in homelessness this year, and so it seems like a good time for us to address that. I wanted the committee and not just of the oversight, but of the coalition wants to thank the board and for helping the last couple of years for providing increased funding, which has enabled CPS to reestablish updating the PNPs, authoring of new PNPs, which they'll address when they present, facilitation of these PNPs in a mobile format to make them more easily accessible for social workers, and also quite a few other things. Also, the Division of Public Health gained 4 additional public health nurses to assist CPS in child maltreatment and prevention, and 15 additional social workers were able to be hired because of the work of the board. And we've observed progress in these areas, and again wish to thank the board for their support. So in summary, to be more specific, one is we would like increased funding for more PHN support, to encourage the board to encourage the Sacramento Sheriff's Department to provide for more resources for the investigation of child abuse reports, to form the blue ribbon panel that we've talked about, to support stronger drug and alcohol policies, and ensure there are adequate resources available to CPS to evaluate the caregivers that have abuse problems, training, testing, and consultation. And then regarding recommendation number 8, that is all dependents of CPS have the same level of intervention and attention that is afforded to CSAC kids, this commercially sexually exploited children, and also to officially support all of our other recommendations. So with that, we have our last slide, questions.
Okay. Well, thank you, Dr. Johnson, for your presentation and for summarizing, and we'll go to board members for questions, and Supervisor Cerna.
Great. Thank you, Mr. Chair. Well, first of all, thank you for another very thorough report, and appreciate all the hard work of the Oversight Committee. I want to dive a little deeper on the recommendation for the Blue Ribbon panel. There's not much in the way of detail here in the board letter about the time frame of the shelf life of the Blue Ribbon panel. When we established the Blue Ribbon Commission for a disproportionate African American child deaths, we set out for 18 months worth of work, and that culminated with some preliminary recommendations back to the board, but also simultaneously with the establishment of the Blue Ribbon Commission and all of its good work, great work. We also went out and did a roadshow a bit in terms of going out to those parts of the Sacramento community, both the city and the county, where we knew by way of the death reports where the disparities were most pronounced. So is there a similar intent that there would be some direct community outreach, if for no other reason, to deliberately educate the public in their communities, in their neighborhoods, about child abuse, neglect? So maybe just put a little more flesh on the bones on this Blue Ribbon panel idea.
Well, thank you for asking. We would, well, collaboration is very important, so that's one issue that needs to be addressed. There are issues, and we've seen them, I've seen them in the nearly 20 years I've been on the committee, between medical people and CPS and vice versa, between CCS and CPS, between police, law enforcement, and CPS, between police, law enforcement, and the medical community, and all other issues. And so we want to increase the collaborative thing and find out what are the barriers that are preventing a better collaboration and how to make that go away or certainly improve. We want to be out in the community because the police, the CPS, the doctors, all those people can't solve the problem. It has to be involved. The community has to be deeply involved, and CPS is out in the community, so they're already out there. So we just want to find out other ways that we can engage the communities, and so the community be deeply involved in this process. That's the vision, anyway. And we've never sat down to formulate a plan because we would like the board's support, and then if that happened, then we could, I think, move forward with trying to do that and then presenting what we've done to the board and see if that's something that they'd be willing to do. But yeah, the community needs to be involved, and there's certain, just like black deaths from certain zip codes, the CPS deaths are more in certain zip codes, but they're scattered all over the county, you know. So we want all sorts of people involved to try to just improve and then come together with recommendations that everybody, at least that would be on this panel, can agree to. So I don't know if that answers your question.
It does, sort of.
I know. We're not that specific.
But you are honest. What about the need for resources to carry out the mission of the Blue Ribbon Commission? Is it maybe, I don't know, Michelle wants to address this, or Dr. Heller, but would there, you know, if we're going to do more than just expect to hear about this interest in a Blue Ribbon Commission by this time next year, is there a budgetary request that comes along with that? And maybe it's somewhat nominal, I don't know. Well, what's it going to take to, from a resource allocation perspective?
Well, I would envision, and that's only my vision, is it's a time issue, not a. I mean, there's places to meet. There's people that are willing to meet, and they just need to be sort of told, if you will, that we're forming this panel and we want them on it. The hospitals and health plans would be more than supportive. And so I'm not, you know, as things get moving, then we might ask for some, I'm just throwing this out, some clerical support possibly. But in the beginning, I don't see we're not asking for money right now. We're asking for support of the idea, and that the Board of Supervisors would feel that such a blue ribbon group would be a good thing to do, and that we will support them at least verbally at the present time. Because we're not asking, at least the Oversight Committee is not asking for money for this.
Okay, great. Thank you.
Okay. Other questions by board members of the report? Okay. Well, thank you, Dr. Johnson. We're going to hear from our staffer as a response. We'll call that item, and then stand by. We may have other questions. So, all right. Flo, we want to call the next item, please.
Item 80 is the Department of Health and Human Services response to the Child Protective Systems Oversight Committee 2016 Annual Report.
Okay, thank you. Dr. Heller, good afternoon.
Good afternoon, Mr. Chairman, members of the Board of Supervisors. I'm Sherry Heller, your Director of the Department of Health and Human Services. Appreciate this opportunity. I think we have had an amazing year of work with the CPS Oversight Committee. An increasing level of engagement and transparency and learning. I think we may have finally met the standards of the Oversight Committee for becoming a learning organization. And I think we're all taking a lot of pride in that. And it's bi-directional. I think we've had a lot of opportunity to teach how we work to the CPS Oversight Committee, and I think the line staff and the management team at CPS also sees that committee now as an asset and insights that help us be more confident in our work. We have, in our written response, responded point by point to each of the recommendations of the CPS Oversight Committee and its report, and it's not my intent to repeat those here, although I'm perfectly happy to answer any questions you have about that. Instead, I'd like to use this time to address three issues that we've talked about quite a bit with regard to CPS. Number one is staffing and vacancy and retention rates. Number two is the effectiveness and the response times at the hotline, which has come up. You've asked me questions about that before. And number three is where we are in our implementation of a continuous quality improvement process. So I'm going to address those three things, and then I'm happy to take questions about specific recommendations if that's where you'd like to go. With regard to staffing, our vacancy rate our monthly vacancy rate was at our worst in August of 2015, when we had a vacancy rate at CPS of about 18%. That was in August of 2015. Our current vacancy rate in April of 2017 is just under 11%, 10.8%. So we are making slow and steady progress. And there's detail that I can provide about how we're doing that. We've had some major hiring events, systematic hiring events, multiple. We've had 6 so far, and we have another one coming up. We have filled more than 100 social worker vacancies since January 2016. Since January 2016. We're conducting a 7th one today, as a matter of fact. I want to hasten to add that we are seeing improvement in retention of our newly hired social workers as well. Of the 112 social workers that we hired between May 2015 and April 2016, So you have that map in your head. That's, people who've been here more than a year. Of the 112 we hired during that period, 73 remain. So that's a 65% retention rate for more than a year. And of the 90 social workers we've hired since May of 2016, so that's just a year now, we have an 87% retention rate, which is excellent. We're very pleased with that. A lot of innovation, hiring the social workers in cohort groups so that they train together, they have some camaraderie. We have them participate in program-specific trainings. Seasoned social workers, by the way, can also participate in those trainings if they like. We have established utilization of peer trainers, seasoned social workers who are paid a differential to help support the new social workers. We're currently piloting alternative work schedules, telework, other kinds of innovations. And the feedback about all this, especially the peer trainers and the cohort approach, has been excellent. In fact, social workers from the original cohort recently on their own hosted a celebration gathering together to say, hey, we made it, and it worked, and we're a team. So all of that I feel really good about, and I think we're making really good progress on staffing.
Sherry, can I just ask you, while you're talking about vacancies, and I don't want to throw you off your script, but
Sure.
As it relates to public health nurses, because it was included in the response, and you had kind of two groupings, the ones that CPS employs and then the ones that provide resources for case management in foster care. But one of the things that was alluded to, at least as it related to those in the foster care, that of the 15 public health nursing positions there, more than 30% either were vacant or would be anticipated to be vacant through one retirement. Mm-hmm. And so, again, recognizing, what you've done, again, I kind of building off your comments about what you did in the social worker context, recognizing that there were a pool of folks hiring in cohorts, hopefully improving the retention through a combination of things, as you've cited, and probably others as well. What about with public health nurses? I don't know if you intended to address that or not, but it just occurred to me as you were kind of going through the topical areas, that was one where the board made a conscious effort. Obviously, your department supported it, county executive as well. We had the discussion last year, and yet we still are down any number of positions. And so it's great to have authorized positions and salary savings that accrue, but that doesn't get the work done, and not unlike what we've seen in social workers and other positions. And so because all I got out of this is that we're going to work with personnel services, public health, and CPS to work collaboratively to continue to address hiring strategies. But
I'm happy to address the question now rather than taking it later.
Yeah, that's fine.
But I wish I had a whole lot of innovative ideas about how to solve the problem. The problem, I can tell you, is statewide, because I meet with all my colleagues in public health as well as child welfare, and there is a shortage of licensed public health nurses across the state, and the demand for them is growing. In part because the population is aging, in part because I think programs like CPS and others have seen the value. Families are more willing to accept advice about how to take care of their babies from a nurse sometimes than other professionals. I can just tell you, for example, that of the 40 candidates on our most recent certification list for public health nurses, and we went after them very aggressively, only 2 responded with interest in the CPS-related jobs. So it's challenging work. There's a lot of demand and not much supply. It may be a question of enhancing our internship relationships and so forth. We're giving considerable thought to what would make this role more attractive so that we can attract people. And we've had great support from the Department of Personnel Services about reaching out to students at the right time in their careers for internships and so forth. We're continuing. I'm open to innovative ideas.
I appreciate it. I know Supervisor Cernan wants to weigh in. I guess I would just, when you're done, but maybe ask Dr. Johnson too, because again, it's one thing for the committee to say that, but maybe there's some ideas, and I trust those would have been communicated already. But again, if there are other strategies that, as you said, internships being one, but maybe some other ways to get at this, and recognizing they may be at a premium in the marketplace because of their value, added to obviously the other work and the other complement of the team. but we've got, school nursing right here in Sacramento, and I would hope that we could
Right.
find folks that were going into the PHN program could want to come and work for this entity and to serve the people of this county and its children. So
I haven't seen a solution yet that I'm willing to propose because I know it's worked elsewhere. On the other hand, we've had so much success with our innovations in hiring social workers that I'm kind of optimistic that if we put our thoughts together, our heads together, we can come up with a strategy for public health nurses.
I appreciate
as
your
well.
point, because that was what made me think about asking this question when you were saying that. So, Supervisor Cerner.
Thank you. So just to follow up on that line of questioning, what are some of the other opportunities for public health nurses? In other words, the 38 that chose not to go to explore an opportunity with CPS, what are the competing opportunities for those public health nurses?
A lot of them are working at schools. A lot of them are working for managed care organizations, hospital systems.
So you're talking about people that are come right directly out of programs.
Yes.
Not those that are someplace at a point in their early careers where they got a fork in the road within our organization. These are folks that are deciding whether or not to even come to work for the county.
That's correct.
Okay.
I'll say parenthetically, during the break, during the break this afternoon in the action
The
here,
short break.
I was trying to catch up on reading the what coverage I could find about the new federal budget, and I think there will be significant cuts to some of the programs where those public health nurses are going now. So it may be that we have an opportunity to pick some people up in this program who will be losing support in nurse-family partnership and other kinds of programs.
To what extent have we employed certain instruments to figure out whether maybe is it compensation, is it security that is a competing consideration by folks that are coming out of nursing school that they choose not to, in terms of why they choose not to come work for an agency like us?
I don't have good data on this. It's not like we've done a survey and I can quantify it for you, but I've spent a lot of time talking to the team about the people they tried to reach out to who weren't interested. And anecdotally, I hear two things. One is the salaries. You could just get a lot more in a private healthcare system, a medical sort of a system, and so there is a compensation issue. And then secondly, I think people are feeling a little bit unprepared and frightened by the child welfare work. What they know about it is what they read in the newspapers, and it sounds scary and it sounds lonely. So I think one of the things we need to do is get the word out about our team approach and how much support there is, and the cohort kind of hiring. That's the kind of thing that really turned around our social worker hiring. It didn't seem so lonely and scary. I also think the fact that we're doing good work and we're improving and we're not having the court officials scold us as much, it's more rewarding, and I think we need to get that message out as well.
How early in someone's collegiate experience, someone that's studying nursing, are we reaching out to explain that this is an opportunity for them? It's an option. Do we go to our local universities when young people are juniors, for instance, during career fairs, to let them know that this is a career path that might be very, very satisfying for them?
I don't have a clear answer for you, and I don't want to speculate about when we approach them. What I do know is that we're really aggressive about internship opportunities. So that makes me think we're not waiting until too long. We are getting interns.
One of the contracts you authorized a couple months ago was internship program through Sac State, and the team came, made a presentation to department heads, and they are looking at seniors, juniors that would be interested in any kind of county aspect. We're growing that program. It should be more robust than what we have. So that is on our work plan to grow that.
Maybe after promotion from the 6th grade, be a good place to start. Recruit them early.
Thank you.
Shall I go on, Mr.
Yeah,
Natoli?
please.
Okay.
Sure.
The next topic I wanted to address briefly was data on the hotline. It's been a frustration to me that for 2 years running at budget time, Mr. Cerna asked me for hotline data, and I stumbled through not having answers. And this year we broke the back of that problem, thanks to great support from Rob Schultz and the folks at DTEC, who really traveled with us and spent time in our hotline and understood our needs. We have improved our data collection and are still improving it. And as you might expect, when social workers are presented with data, they change, they make improvements, they change the way they're assigning tasks, they change the way they're organizing, and it is having an immediate effect. So just between December of 2016 through March of 2017, we've seen a 68% reduction in hold times for calls to an intake social worker, going from over 17 minutes to just over 5 minutes of wait time. And now that's calculated over an average over the 24 hours. There are peak times. In our peak period, generally between noon and 2 o'clock, CPS receives an average of 29 calls an hour. So that'll give you an idea of the absolute figures. I hate to just give percentages and you don't really know what that means. But just little improvements are making a huge difference. For example, in April, we updated the hotline greeting menu. When you call and you get the recording, press 1 for this, press 2 for that. And the time to get to speak to our answering receptionist improved from 4.5 minutes to less than a minute, just from changing the cue and the greeting to make it clearer. Mr. Cerna always asked me about dropped calls, and I never had the data before, and now we do. So we know that, for example, in 2016, the average number of dropped calls per month, people who gave up waiting, was 360. And in 2017...
A day?
Per month.
Oh, per month.
Per month. That's a monthly number. And in 2017, the average per month was 194. So it went from 7.5% of our calls down to 5%. Still not where we want to be, and we're still making improvements, but at least we have a handle now. We're working on it. We continue to make improvements, and we're now developing even newer data reports for peak call volume, average call duration, length of time between calls, and so forth, so that we can assign better.
Dr. Heller, I may have asked this question last year, but
probably.
when there's a dropped call, is there a legal ability for the hotline attendant to call that number back? Is there even the means to do it? Do they have the phone number? Does it appear? Or is there a privacy issue for them to even be proactive to kind of reverse engineer the call?
I'm not certain about the legal issues there, and so I'd prefer, let me get back to you on that. I'll take that as an action item.
Yeah, if it is, if we are legally able to do something like that, and the right minds got in the right room and decided that was the right policy, after vetting it, it might be something to consider.
My initial instinct is some reluctance, because if people are placing a call from a home where there's domestic violence or
right.
something, you don't want to call that home back and say, "Hi, it's CPS.
Right.
You called."
Right.
That it seems to me that I want to think through how we might accomplish something like that and not lose access to that reporter.
Right. But that has to be measured as one of the a big failure. To be able to lose contact with someone that is in that kind of distress concerning the welfare of a child. I think we can all agree it's unacceptable, and we wish it doesn't happen, but
yeah.
If there are some creative ways to use even dropped calls to somehow navigate access back such that you don't put the caller in danger, you don't put the child endangered. I think it's worth exploring.
In earlier work that I did with call answering services in the child support world, we could allow people to choose, your wait time is now 3 minutes. If that's too long for you, can you leave a message and tell us a safe time and number to call you back at, and we promise not to call at any other time. So, I mean, we could explore some options like that. I want to finish up my prepared remarks by talking a little bit about the quality improvement process, because this is the thing I think that's transformed CPS the most, at least among the things I'm talking about today, and made me say how proud we were at the beginning and how I think we've become the learning organization that we were asked to become. Our commitment to continuous quality improvement has permeated our organization. We deal with practice issues, with policy issues, systems issues. We do case reviews. We review critical incidents. We do permanency reviews for kids who've been in foster care too long, and specific concerns that are raised by me or by Michelle Callejas. And here's the loop that that we're excited about and that we're proud to report to you. It's not just a question of doing the reviews, but deriving the lessons learned, incorporating lessons learned into training, which is a very fast response now, not long in the future, because of the support this board has provided for our training unit, and then monitoring of the effectiveness of the training to see if it took, and it goes in a continuous loop. Examples, the case reviews have turned up an issue with some of our safety plans, and whether you've heard this before, right? We're acknowledging that there's issues of whether some of our safety plans are as effective as they could be, and also with skills on doing body checks to make sure that our social workers don't miss something when they're visiting with a child. So we did a training, we delivered the training. The staff then conducted safety plan and body check qualitative reviews in November and December of this year. And we had discussions with staff about the results of those reviews. A follow-up review is planned for this August. So there's that continuous learning feedback loop, and that's just one example. There are many others. The Quality Improvement Committee meetings have been extremely effective, and we're very grateful, in fact, that 2 of the CPS Oversight Committee representatives are on the Quality Improvement Committee. Now that's a level of sort of openness and transparency that did not characterize this organization for many years. Examples of that work: a root cause matrix about what the underlying problems are that lead to abuse and neglect, and a QIC, a Quality Improvement Committee recommendation tracking log, so that we make sure that the lessons learned aren't lost. We're seeing them get implemented staff by staff, training by training. And we do that for each unit: intake, emergency response, permanency, adoptions, and so forth. The feedback on this has been extremely positive. One social worker reported to us that it's been the best training I've ever had. So I think this is giving, it is making, I think these things I've talked to you about hook together. In other words, the increasing confidence and system support and the feedback loops and the training make the job less scary and make our staff more confident, and that helps us with our recruitment and retention. So those things kind of hang together. We are very grateful for the support and participation of the line staff, the frontline staff, who contribute to this process. They aren't just implementing what's being given to them, but they contribute ideas, as well as the supervisors.
Can I interrupt real quick?
Please.
So on that point, I was going to ask you, how invested do you think our line staff are? Hotline operators, all our social workers, anyone that's not management per se, are they feeling invested in the good ideas? Are they feeling invested in the evolution of the department? Do they get to enjoy some ownership of the successes? Is there a deliberate means for there to be a welcome mat for those good ideas coming from the very people that are asked to be frontline staff?
I think there are many of those opportunities, and I think also that our relationships with the labor organizations that represent the frontline workers and the supervisors are strong as well. I mean, we take some criticism, for example, for the fact of how long it's taking us to revise the policies and procedures. On the other hand, in part that's due to the fact that we take our meet and confer obligations very seriously. We're not just rolling them out, we're listening to the feedback from the people doing the frontline work and taking their input very seriously. So we have labor management meetings, we have work groups on all of this. And I think the way that the frontline staff are responding to the trainings is an indication that, they're giving us feedback on how to make it better. We're not building the trainings simply out of what's coming down from management. We're building the trainings by what the line workers are telling us, make them more confident that the judgments they're making are correct and that they feel supported. So I'm not saying it's perfect. We come up with conflicts that come up at labor management meetings and so forth. But we have a workload policy board and program-specific work groups that help us manage the workload so that people feel like they can do their best work instead of being overwhelmed. We're not there entirely yet. We're a learning organization. We're not a completely perfect organization. There's work to be done, but I think the reason our recruitment and retention is improved is because people feel heard and it's a better place to work than it was a few years ago. And I give a lot of credit to Michelle Callejas and her management team for that, but also because to the frontline workers and their labor representatives who are very invested in getting this right.
Thank you.
I don't know if you want to ask me details about the recommendations, but they're all, we responded to them one by one, and I don't want to just call out everything we said in the memo.
Yeah, thanks for, I think, highlighting some of those areas where we're showing progress, but also obviously continue to work not only in response to the Oversight Committee's recommendations, but obviously to what we understand to be some of the critical aspects of working within the child protective system here in this county. I wanted to ask you, and maybe other board members have questions too, just on one other recommendation. This relates to or it's connected to discussion we had during budget. You gave a report earlier this year, and on the drug testing and substance abuse training, but also the access, not just access to testing, but then if you have adults, parents, or caregivers who do the voluntary drug test, and then they test positive. What about? And I know, Dr. Heller, you certainly have been here, and I think we made some movement in the right direction, trying to secure some additional slots for treatment. But here, where you have a family situation, I don't know, maybe structure or not, but and you've got adults in the picture who, and I think this goes in part to those who may not choose to test, and what do we do about that if we have reasonable suspicion or expectation that something else is going on? What about that, though? Is this one of those where it goes only so far, and we have trained social workers, and we're doing a better job of analyzing in the field the risk for the children that are dependent upon the parent or the adults, and voluntary and involuntary, we get drug testing and we find we got a problem. Obviously, you can remove the children, you can do other things, other strategies, but what about access for those who know they got a problem and got an addiction and they want to deal with it, and they want to deal with it now without losing their children, at least more permanently than not. So I guess I'm kind of curious about how that's working out there in the real world, and recognizing that we still have, I think, far more need than what's being met, certainly through county-offered or sanctioned programs or partially funded programs. So could you take a run at that? What's your sense of that is?
First I'm going to answer from a CPS perspective, and then maybe from a behavioral health perspective. I feel very confident about the appropriateness and the attention being given in our training, our CPS training program, to issues of substance abuse. We're doing a lot of it. We're covering a lot of material. The most recent one we did was called Recognizing Drug Abuse in the Home. Just offered that in February and March of this year, mandatory for social workers, supervisors, and even family service workers, you know, who do the transportation, and managers, so that everybody knows what they're looking for. So I feel pretty good about training. In terms of access to testing, we have contracts with Strategies for Change, Bridges Treatment Services STARS program, and the National Council on Alcoholism and Drug Dependence. So I think we have adequate coverage for drug testing when we need it. I think the issue that the Oversight Committee raises about making it automatically a high-risk feature is fraught with complexity. It is certainly true that we see substance abuse in a lot of the homes where abuse and neglect is confirmed, but there's this issue of we don't want to make people not voluntarily get treatment because they're afraid of the CPS implication. Right? We don't want to create a world in which I'm not going to tell anybody I'm taking these pills, and I'm not going to ask for help because I'm afraid they're going to come and take the kids. So there's the issue of setting up the contingencies so that clients choose to seek help and don't think that there's risk in doing that. And you know, of course, that we don't remove children and pursue custody unless they're in danger. In other words, if we just went to court and said we'd like permission to remove, we'd like authority to remove this child because of the parent's drug abuse, there wouldn't be sufficient evidence. Without the evidence of child endangerment, that would not likely to be succeed. On the issue of access to treatment, I think that we're doing pretty well on outpatient treatment, which is appropriate for some substance abuse problems, and we don't have adequate residential treatment, which is appropriate for some of for meth and other drugs, where a once a week outpatient or twice a week outpatient visit is not going to do it. And we will very shortly be presenting to you the first step in opting into the waiver that will vastly increase potentially the resources available for access to treatment.
And you hit on a critical point. I'll let you finish, but just, when it comes to meth, and I think when you were here a few months ago on talking about, the work that had been done identifying some of the opioid addiction and some of the, rising rates there, that, when you've got that, and whether it's by pill or by IV injection or other means, those are types of things where I think that the assessment certainly in the field of what the child's situation is, but then if you don't have the inpatient treatment in a lot of those cases, then then the expense mounts, because if you can't help them get help and you've identified the problem, and then you make the call that this is a dangerous situation, then the children have to be placed somewhere, maybe with another family member or whatever. But I mean, then the work obviously the social workers do, that all those that are the team of folks behind it, and I guess I just got to believe that substance abuse is one of the main contributors to the situation, certainly the more critical ones we see, but even to the situations we see that may not rise to that level, that there's warning signs and somebody reports an incident, and then we compelled certainly to follow up, and then we get into it. And I'd be kind of curious to note, and we see this certainly with the child death review team, and some of the other reports. And I heard Dr. Johnson say they're going to look at critical incidents, but unless I'm way off base, I got to believe that in a preponderance of cases that there's drugs or alcohol that are part of the the whole.
It is clearly a risk factor. I want to say one really positive thing, and then one thing that worries me about this.
Okay.
The really positive thing is that one of the most effective programs I've ever seen anywhere, and certainly one of the most effective in my department, is our early intervention family drug court and dependency drug court program. Right. Demonstrably reduces risk to children. And why is that? I think we've talked before about the fact that drug and alcohol treatment doesn't always work. You've got to have a reward for getting clean that's as rewarding as getting high, and keeping custody of your children meets that standard. It is an astonishingly effective program. So that's my good thing. My thing that worries me is I think that the CPS Oversight Committee was right on when they said we need to pay more attention to those evaluate out analyses. So on the one hand, we don't take custody of children just because their parents use a substance or even abuse a substance. On the other hand, I think we do need some analysis by the QI committee to ensure that we're not
What's evaluate out? I was going to ask you what
evaluate
that
out is when we get a call to the hotline, but there's not sufficient evidence to justify an investigation. And the question of if there's substance abuse, that's not enough to prove abuse and neglect in a court and to take custody, but are we evaluating out on that basis and assuming there's nothing else there, or should we be checking more? I think the CPS Oversight Committee is right that the QI committee should spend some time looking at that issue. I think that's an unanswered question.
Could I just ask you one follow-on then, recognizing that, in certain situations, drug court is the way to go, but that doesn't have unlimited slots either. If I recall right, that's like, a couple dozen that folks at any given time can occupy. And when you look at a county of this size, the number of complaints you receive, again, what I got to believe is, certainly a fairly substantial number of those that involve drugs or alcohol. The motivation, you said, obviously, keeping your children or getting them back and, getting on the straight and narrow, all being, drivers behind, hopefully, changes in behavior. But is that an area, frankly speaking, that we ought to be looking to find more funding for? Again, we're not the only one that controls that. Obviously, the courts that are involved, and there's probation, and there's CPS, and there's other.
There's two pieces of good news there.
Okay.
One is you already did.
Yeah,
this board did vote in September in the final adopted budget for this year to expand access to those dependency and early intervention family drug courts. I think we're serving 100 or 150 additional families as a result of that, so that's great.
Good.
And the second piece of good news, and I keep glancing at Mr. Gill because I kept thinking he's going to interrupt me and bring this up, but I'll take the risk and do it myself, is to say that he shared with the department heads the work plan that he's talking about for the CEO and the board, and a major review of substance abuse and its impact on other programs is on that work plan. He's formed a committee of department heads, and the probation director is on it, and the legislative director is on it, and the homeless director is there. So we're all going to be doing a very systematic and thorough overview in the coming year of what we need to shore up. So I'm quite optimistic about that effort and extremely gratified by Mr. Gill's interest in it.
Okay, thanks. Just one other question. Maybe this is for Nav or for you, Dr. Heller, maybe even for Dr. Johnson. But so cases that fit that critical incident, I assume there's some randomness to that. There are some other alerts, on the file or situation. Are there other ways for critical incidents to come to the attention of the Oversight Committee? And I turn to you, Nav, and Dr. Heller. So in the event that if community members, beyond the, initiating a complaint, but if they're concerned about how things are handled or for improvements, is there a way for folks, who say they were in the faith-based community, or they might come to one of us or come to, to you, Nav or Dr. Heller, are there ways then beyond the immediacy of dealing with any particular situation that those can get to the Oversight Committee in its role to take a look at?
The answer is yes. For example, we have issues raised by other advisory boards, maternal, child health, and so forth, that come to my attention, and I ask the Oversight Committee. I refer cases, as does Michelle. When issues arise to Michelle Callejas, she refers cases to the Oversight Committee. But then I would also remind you of the structure that the CPS Oversight Committee is a subcommittee of the Children's Coalition. Right. The Children's Coalition also has a policy and advocacy subcommittee that raises issues. And so the Children's Coalition can use its own structure in that, and you folks appoint a wide variety of community members to the Children's Coalition. So that is another mechanism for getting issues looked at.
Okay. I don't have anything else you wanted to add to that?
She described it.
Okay. All right. Thanks. Any other member of the board? Any other questions then for Dr. Heller? Okay. And then I thank you for that.
Thank you.
And let's I just turn to Dr. Johnson. Anything else you wanted to add on behalf of the committee? We had both the items called. Anything else, Maynard, that you'd like to? And then we'll bring this item to a close here.
Well, just that we just got the response from the CPS in the last couple of days, so we really haven't had a chance to look at the response. But we're meeting with them in June, so we'll go over their responses and in detail. But I would have to say that the collaboration, all the years that I've been involved, it's always seemed to be wonderful, and yet we still have issues, but the collaboration has never been an issue. They've always, in my opinion, been very forthright, and they've always worked with the Oversight Committee, and they've always taken, there's not ever been a recommendation that we've made ever, that I know of, ever, that they said they would never do. They've always accepted our recommendations, and we put no timelines on our recommendations. We asked them to put a timeline, but we never put a timeline. And if they do put a timeline, then we try to hold them to it. But we never say this is a timeline.
Okay.
So we'll talk. Hopefully, we can get some of these issues addressed by the time we have our next meeting next year.
Okay.
Thank you for all your attention.
Thank you. Now, at our place today, there was, or maybe we came in advance this morning, there was communication from folks, the program specialists for the CPS training team, and I don't know if you got a copy of that. Not everybody's time to speak to that, but it relates to, I think, compensation for work that's being performed, and so I'll refer that to you and to Paul for your attention, Dr. Heller, so you may be aware of it, and I don't know how it gets...
We'll get a copy from Flo.
Yeah. All right. Very good. Okay. So we have recommendations from both receive and file from the committee as well as from our staff, and thank Dr. Johnson, Dr. Heller, and all those who contributed to those efforts. And again, we'll continue to be kept apprised of progress. I was Supervisor Cerny, you'd ask, did you get sufficient response relative to the blue ribbon discussion? The team?
Not really. I mean,
okay, well, I know. I kind of sense that. So
let me take a shot at it. I think they're still developing, and we'll continue working with them. Next year when we present, or if we need to come prior to that, we'll come back and present something to you, flesh it out if that's acceptable.
Well, it seems to me that it's kind of a binary thing. We're either going to do it or we're not going to do it. So we don't need a whole year to assess that, right?
No, we don't. I just want to respect their time. I want to meet with them or have Paul.
Why don't you align it maybe for the, again, it may or may not be budget related. It didn't sound like initially it's going to be staff, certainly there will be some dedication of time and appointments. Why don't we look at the late August, early September time frame? That gives a time for, obviously there's a lot in this report. That puts it about, 70 to 90 days out, and we can at least know, because if we want to give that direction, and that would get opportunity for our staff, for the committee, and you folks to kind of see where we are and bring that back. So is that acceptable?
It is.
Okay. All right, that's what we'll do. We'll look to that. So get that on your future agenda with everything else. So, all right. Well, so receive and file. Thank you all. I had nobody signed to speak on 80 or 81. Anybody else wish to address this? All right. If not, thank you so much, and we'll see some of you back here in the next few weeks. Budget hearings. Okay, let's call the next item, please.
Okay, for item 82, I do need a motion to drop this from the agenda. It's the Franklin Electric Transmission Project.
Okay, I move that we drop that item.
Second.
Please vote.
Ms. Frost?
We're voting to drop item 82. Yeah, it'll return. They had some changes in the project. Okay.
Unanimous vote with those members present.
Thanks. Okay, next item.
For item 83, approve residential permit parking plan for Coyle Avenue neighborhood.
Okay.
Good afternoon,
Lupe,
Chair
good to see
Natoli,
you.
members of the board. Lupe Rodriguez with the Transportation Department. And so today we're here to consider the inclusion of the Coral Avenue neighborhood into the residential permit parking program. And so I'll have a short PowerPoint presentation, and we'll go through that quickly since we're a little behind on time today.
We have our youth commission waiting. Go ahead, Libby. It's fine.
So again, we're here to consider the inclusion of the Coral Avenue neighborhood into the residential permit parking program. To give a little background, in October of 2006, the board adopted an ordinance establishing the residential permit parking program. The permit parking program was created to mitigate the problem of overflow parking into residential streets by adjacent commercial and recreational facilities. The permit program has been effectively implemented on residential streets near community colleges, senior living facilities, the American River Parkway, and other similar locations. So the neighborhood that we're here to talk about specifically is basically a single-family home subdivision adjacent to the Mercy San Juan Medical Center. And so what we're hearing from residents is that hospital staff and visitors park in the neighborhood on a regular basis, and then therefore create additional nuisance issues in the neighborhood. Some folks cannot park in the street in the near their homes. Other visitors parking there, they leave trash, and then there's also some questions about safety issues because of different people parking in the neighborhood. So in response to the request from residents for this parking restrictions, staff did hold a neighborhood meeting to discuss the overflow parking issues and ways to help mitigate that, meeting was very well attended, by the way.
Did you say ways to self-medicate them?
Mitigate.
That's what I thought I heard too.
We're not CPS anymore.
Enunciate.
That's MIT, not MED. Yeah, okay, got it.
So then continuing on then, the neighborhood that we're talking about is just south of the city of Citrus Heights. It's in the area just north of Madison Avenue and west of Dewey Drive. And basically it's just across the street from the Mercy San Juan Medical Center. The neighborhood in question is outlined in red and includes about 4 streets in there. And so, as I mentioned earlier, staff did have a meeting out with the neighborhood to talk about the parking issues. And so one of the things that was discussed was the permit parking and the size of the neighborhood that would be included in the initial part of this program, and 2, the hours and days where the parking restriction would be effective. And so that's generally some kind of a compromise, because you don't want to be too strict, because then all neighborhoods won't really support it. So you have to find a good medium so where you think the whole neighborhood will support. And so in this instance, the neighborhood decided that the restrictions would be Monday through Friday from 6 a.m. to 6 p.m. because that would help best mitigate the issues regarding the parking from the hospital. And so after this meeting, staff did send out a survey request out to inquire to determine what kind of support we had for the neighborhood. And of the total number of properties in there, we have 75 properties. And of those 75, we received 63 back, which is 84%. And so of the 75, we received 53 in support and then 10 in opposed. So I think we have about 16 that didn't respond. So overall, for this kind of a program, we require a majority of support from the neighborhood that's included in order for the board to be considered for inclusion. And in this case, we have, like I said, 71%. So it's very good support. So therefore, because we have very good support out here, the staff's actually recommending to approve the resolution establishing the RPP zone for the Cole Avenue neighborhood as shown in attachment 2. And also we're requesting that the board direct SACDOT to proceed with implementation of the residential permit parking program in the Cole Avenue neighborhood. So we're here if you have any questions.
Okay, thanks. Thanks, Lupe. I know we have a couple of supervisors, and then we have some speakers as well. So I have Supervisor Frost and Supervisor Peters.
From the day I took office, this was probably the first issue that my office worked on. And I just wanted to thank the Department of Transportation for conducting a very thorough public process. The residents out there were very happy with the way things went, and I would like to, when the time is right, be the one to move this item for approval.
Okay, thanks. Supervisor Peters.
Thank you. I would just say I'm glad to see this item in front of the board. The parking there has been a problem for a long time, and Mercy Dignity Health now attempted to fix it when they did their expansion, and it didn't, and it's just been a really difficult situation for a long time. So I'm glad to see that they got enough support together to bring this forward. I only say that because I used to represent that area and worked with it constantly.
I remember a discussion when they were coming through for the expansion about some of the
Yeah.
impacts and what people anticipated. So, okay, with that then, Lupe, stand by. We've got 3 people here to speak. They've indicated in support of. I have Frederick Castillo, Margaret Condon, and Marla Simpson, and would invite you to come forward if you'd like to. So, Frederick. And then followed by Margaret and Marla. You can speak in any order you wish to. So,
I am Margaret Condon, and I live on Milburn Street, included in this neighborhood program. I really would ask for support to get this program implemented. It's very difficult, especially in my particular situation. I have caregivers that need to park. I have old friends. I'm old, so my friends are old, and so they can't park, anywhere near our home when they come to visit. And then occasionally there's the fire department that comes out and picks my husband up off the floor. So we do need to have a fairly clear street, and I would appreciate your support for this program. Thank you.
Okay, thanks, Margaret. Okay, Frederick.
Thank you for this opportunity.
You bet.
My name is Frederick Castillo. I live on the corner of Rexford and Milburn. And the parking, early in the morning, as early as 7 o'clock when I have to leave for work. Going from my block going south, it's really hard to make the left-hand turn. Now, the county was really good enough to extend the line for parking, which really helped out considerably, but still, it's a lot. Like this morning, I happened to be off today, and just the cars to me coil right in front of the hospital. There's no parking. The only thing that I want to bring up is on the west corner of Milburn and Coyle. You'll have 3 or 4 cars parked there, and when you get to the corner trying to make a left-hand turn, especially in the morning with all the school traffic, it's almost impossible to look to the left and to kind of make a clear path to go through. So you might want to consider that corner. It's the west corner of Coyle and Milburn. There should be,
No parking sign?
I'm sorry?
A no parking sign?
Well, either go the 6 to 6 or no parking. Because I know that particular resident, a lot of times he's had to park on his vehicles on the grass because he has no room for it whatsoever. Mm-hmm. And I know for me the biggest difficulty is when my wife or my kids get home from college or for work, am I going to have a parking space in front of my house? We have 5 vehicles, and having a corner is nice, and sometimes we don't have that opportunity because I'll have 2 cars parked for a house. I'll have 1 car between my neighbor's house, and even talking to my neighbor, he's not sure when he comes home with his big van that he's going to be able to park in front of his house. So those are the difficulties that we run into. Okay, just in a nutshell. Thank you.
Good. Thanks, Freddie. Mr. Stern.
Maybe transportation could talk to you on the phone and work out a detail on that.
Quick question.
Oh, I'm sorry.
Quick question about the corner situation there. I'm looking at it on an aerial here, Google Earth. Is that it's a radius corner.
Yeah, it's a radius corner. You have a bus stop right by where they put the new water pumping station. And from where the buses aren't allowed to park, going east towards Milburn, you could have as many as 3 cars. Sometimes the cars park right on that corner.
They're parking on the radius.
Yeah, they're parking on the radius. Even, yesterday or a couple days ago, and actually it was Monday, there were 2 cars. I had my car in front because, like I said, I'm off this week. There was a car behind mine, and there was 1 car right on the radius. So that's not uncommon to have a car on the radius of that corner.
Wow, that's pretty dangerous.
Okay. Thank you.
Okay, good. Thanks, Frederick. Marla.
My name is Marla Simpson. Basically, I would say there's traffic on almost all the corners on Melbourne and on St. Charles. So that's what makes it very hard for especially the seniors whose reaction time isn't very good to come on to Melbourne or come on to Coyle or to come on to St. Charles. We also live real close to a elementary school, and most of the people with their young kids won't even now take them to school because they can't see around the corners either. So anyways, I'm just going to echo what everybody else said, but those are the main concerns. Visually, you can't see. I mean, there's down Melbourne, there's bumper-to-bumper parking. The only place that you'll find on the other side of Melbourne that there isn't is where people's driveways are, and sometimes they're even parked, encroaching in those. So it's visually, it's hard to see.
Okay. That's all the folks I had signed to speak. Anyone else wish to address this item? If not, then we'll bring it back to the board, and it sounds like we may have an answer to at least part of the problem. So, Supervisor Frost. Okay. Okay, it's moved and seconded twice to approve the staff recommendation, and again, thank our staff for their work. And if nothing further, please vote.
I would like to make a comment.
Sure, go ahead.
I think transportation needs to talk to these neighbors with those corner parking problems and see if you can work that out.
We will follow up on it.
Make a complete solution.
So make sure there's a sufficient corner visibility. Yes.
Yeah, thank you.
Okay, good. Please vote.
Unanimous vote with those members present.
Okay, very good. Thank you all. Thanks for being out here this afternoon. Have a safe drive back, and hopefully this will be a solution will be put in place very shortly. So you'll be out there tomorrow morning, is that right?
Soon.
This afternoon, still got time. Okay, thanks a lot. All right, coming down to our next agenda item, we have some very distinguished guests in our audience today, and we're going to hear from them in just a moment. So you're going to call the roll?
Item 84 is the 2017 Sacramento County Youth Commission Annual Report.
All righty. Good afternoon.
Good afternoon. My name is Sage Claire. I'm the chair of the Youth Commission from District 5. Okay. And this is kind of a recap of what we've done this year since the last meeting where we presented. So the Youth Commission is a 15-member advisory board of youth all from Sacramento County, all around the area. We have 3 commissioners from each district. Each of them are aged anywhere between 12 and 18. And we all serve a 3-year term, and we are able to renew the term at its conclusion with a maximum of 2 consecutive terms. And in the past year, we've actually had 5 new commissioners join, and there are 5 seniors leaving this year. So we're going through a lot of change right now.
And how many seniors in your group that are leaving?
5.
I know, but I mean, of those that are here today.
Just the one today.
Oh, okay.
But, yeah.
All right.
And then, so our purpose is mainly to represent the youth of Sacramento. So we want to advise you guys on what's best for the youth, advocate for youth in the area, enhance the community's awareness of what's going on, coordinate with organizations that deal with issues that we face, as well as encourage other youth to get involved in their communities, involved in local government, stuff like that. And so some of our recent activities, we did a movie night, that was actually last October, mock hearing, the Cesar Chavez Youth Leadership Conference, the Youth Job Fair, Creek Week, and visiting the Mustard Seed School, which was our most recent. So we'll talk about each one of these. We'll go through the list. So movie night, that was last October, and we worked with Supervisor Peters in District 3. And it was really, really great. There were a ton of families there, a ton of kids, and it was really fun for us too, because we got to interact with the kids, play with them, and there were a lot of teens there as well. So we had a booth there with children's books, candy, like informative brochures, all that kind of fun stuff, a few games as well, snacks, and then we had youth commission applications as well. So any of the events that we do, one of our goals is to advertise for the youth commission, just to give other youth an opportunity to join us and say that they want to be a voice for their community. So we do that at each event that we go to. You'll see that in the leadership fair as well and other events.
You guys get your own shirts?
We got our own shirts, yeah. So those polos in the picture are the old ones, and we've actually ordered new ones this year. So.
And who picked a movie? Supervisor Peters? Did she pick the movie that night?
Oh, yeah.
Yeah, it was great.
We had almost 1,000 people come to the park.
It was incredible.
Was unbelievable.
Yeah, it was really, really fun, too.
Yeah.
I had a lot of fun there, so, yeah.
Finding Dory, I think.
Zootopia.
Zootopia?
Yeah.
Oh, Zootopia. We go back and forth between Finding Dory and Zootopia.
Yeah.
Yeah, it's
1,000 people. That's
It was great.
It was just people were flooding in. It was really an interesting experience.
Yeah. So next I'm going to invite up Leah, and she's going to talk to you about the mock hearing that we did last
Were you
year.
able to recruit some new candidates for the commission, though, that evening, out of 1,000 people?
I think we were. So there's one boy who's interested in joining, and he actually came and saw one of our meetings, sat in on one of them, and he is potentially joining in the future. So I'm not positive if he came from that event or another one,
Okay,
but
very good.
Yeah.
Good. Okay, well, thanks for the presentation. Next.
Good afternoon.
Hi.
My name is Leah Rakucci, and I'm from District 4. And now I will be talking about our mock hearing event we had last November at the state capitol. And so at this event, we met with Senator Nielsen, and he gave us a tour of the Capitol. And we met in one of the hearing rooms, and we debated Assembly Bill 216, which regarded the banning of the sale of vapor products to minors, and the bill AB 319, which was providing pupil instruction of CPR in public schools as a form of physical education. And our youth commission was divided up into arguing for and against in each assembly bill. And we stated our facts for the for argument, and then we had the counter come up and give their argument, and then we would go back to in support. And I think the results of AB 216 ended up AB 216 did pass, and AB 319 did not. And it was interesting to talk with Senator Nielsen because he gave his personal experiences of working in politics, and it's inspirational for us on the commission because we have an interest in politics and being active in our community. And overall, it was a rewarding experience.
Great. Well, thank you.
So now I'm going to invite Eleanor Love to talk about another event.
Okay.
So, thank you.
Good afternoon.
Good afternoon.
I'm Eleanor Love, and I represent District 1. And I had the privilege of attending the Cesar Chavez Leadership Conference on March 11th at UC Davis. The conference included multiple sessions that informed and inspired young people to take action on the issues they currently face. One session I attended was led by Mindy Romero, director of the California Civic Engagement Project, and she discussed how young people ages 18 to 24 are the most underrepresented voters of all ages. She also mentioned that a new California law has been passed that allows 16-year-olds to register for voting early. Another session I attended was led by teenagers, part of a Brown Issues group, and they discussed how advocacy for issues they face, such as immigration and healthcare, changed their lives. So if you don't have any questions, I'd like to invite Crudy.
Okay, good. Thanks, Elizabeth. And here's our senior.
Yeah. So I'm Kriti, and I represent District 4. So this happened, I believe, in April. We went to the Youth Job and Resource Fair hosted by the City of Sacramento. So we set up a booth and represent the Youth Commission, and we provided students, we gave them flyers with research opportunities and internships from different government organizations. So, for example, the district attorney, the Department of Human and Health Services. So one of the purposes of this was to also spread the word about the Youth Commission. So we did give out all of our applications, and hopefully you guys will hear back from them and appoint people to replace me.
You're irreplaceable.
Thank you. And we also want to see what else was going on in the community, and to kind of be a part of it. One other activity we did was participate in Creek Week. So as a committee, we created a volunteer subcommittee because we wanted to take part and volunteer in our community more, just instead of meeting once a month. But unfortunately, since we're all very busy middle schoolers and high schoolers, it's really difficult to find one weekend or one event that everyone can attend to. So I was the only one who was able to go to Creek Week, but still, it was a lot of fun, and hopefully next year, since it's an annual event, more of the Youth Commission can participate in it and set up a booth. So just overall, Creek Week, which I'm guessing all of you have heard of, was just to keep our environment clean and make the public aware about our environment.
Okay.
And next, I'd like to invite Matthew to talk about the mustard seed schools.
Okay, thank you very much. Hello, Matthew.
Good afternoon. My name is Matthew Ha, and I'm a representative of District 3. So recently, about last month on March 31st, 3 other youth commissioners and I visited the Mustard Seed School. This is in West Sacramento. And so the main goal of this visit was to personally talk with the director of the school, Miss Casey Nattel, regarding 2 things. One, a possible partnership between the school and the youth commission, as well as to get a specific set of needs and problems that the Mustard Seed School was having so that we can fix that. So basically, the main problems and needs that they have is, one, the stuff that you would expect, so new clothes, maybe new books for the younger children, and also a big problem that they pushed was a transportation problem, because what Ms. Nattel said was every morning they needed to transport around 10 kids who did not have a form of transportation to the school. And so what they've been doing for a while is they had one big van, which they use and drive around the town to pick up children along the way. However, Ms. Nattel said that this was very efficient. And so some solutions that she said to fix this problem was to, 1, replace the van with 2 separate minivans to make the route more efficient, or to raise enough funds to distribute gas gift cards so that the children who may have a car but not enough money to get gas can now attend school. So next I'll call up Luke with more needs that the Mustard Seed School discussed with us.
Okay, thanks, Matthew.
Hello,
Hi.
My name is Luke Delcor. So pretty much, hold on. Where do I point this? I'm sorry.
You want to go back?
Yeah, I'm good. This is where I want to be.
Oh, okay.
So pretty much our goals in this with the Mustard Seed School. So through their needs, the basic needs that Matthew talked about, and then their unique transportation needs due to the school that they are, we've kind of singled out, well, tripled out, I guess, 3 things that we'd like to focus on. So one of them would be purchasing gas gift cards for them. For the students with cars but who are unable to purchase gas, we determined that this would be one of the easiest ways to increase attendance for the school, because the school is a resource for these children, and we fear that it may not be getting used enough. Our second goal would be to raise money for minivans, and so our purpose here is to create a lasting difference for the Mustard Seed School, because we can give them money, we can give them food, but it's once and done. If we give them a minivan or 2, I mean that seems rather ambitious, but if we give them a minivan, we'll start there. That's something that we can say we've made a difference on, and of course making a difference could simply be donating food to them, donating them money, but this is something that the community can see and that will make a difference for them for a long time. And the third thing that we've been researching and investigating are food subscriptions. So it's kind of a new thing that's been especially occurring in Sacramento, seeing that it's the farm to fork capital and all that. So they have monthly food subscriptions, and we've looked into any that could be maybe increased to weekly so that they could be getting foods every week that would be healthy and nutritious and fun for the kids. So how we plan on doing this. So the events that we've considered are having a movie night, and we've been considering this for a few meetings now, and it takes a lot of effort to put all that on and everything. But we've also just created a couple new ideas, including fun runs and restaurant fundraisers. And we've looked into a couple restaurants already, including Starbucks, where if, for example, a drink would cost $5.68, like a Vanovian Frappuccino, you would increase that to $6, and the rest of the proceeds would go to us. We've looked at Applebee's, where the youth commissioners would volunteer our time on a Friday, Saturday, or Sunday morning, and we would become the waiters and waitresses for the morning, and then some percentage of the proceeds would go to us. And
including the tips, right? The tips, right?
Yeah.
All right.
I mean, I don't know. I mean, maybe half the tips. I can't remember the other restaurant that we looked into. But, all three of these are feasible ideas, and we're excited to get going on them. So for next year, the vast majority of our budget is expected to be dedicated to supplies and event planning for the Mustard Seed School. I would now like to bring back Sage and Leah.
Okay. Very good.
Okay, so we're going to elaborate a bit on what we plan to do next year. So like Luke mentioned, the
Could you stand between the microphones and then we can hear you better? There we go, thanks.
The majority of our funds are going to go to the Mustard Seed School, based on what we're planning right now. So those fun runs potentially, or the restaurant fundraisers, and the movie night is what we plan on allocating that towards. So that's the first item that you see on the list: work with local organizations to bring awareness to children/youth food and health issues. And so that's kind of encapsulated inside of the Mustard Seed School shell. And because of that, because of the Mustard Seed School being what it is, it also affects those who are homeless in Sacramento, which I know is a really big movement right now that's going on. And then we also want to participate and volunteer at more of the community events in our districts, because the ones that we did go to the last year, they were really rewarding for us and for the people we were able to talk to and meet there. And so we want to do more of that in the future.
And as well as our mock hearing last year in November 2016, there's another one coming up in 2017. So we plan on attending that as well. And also we plan to partner with the City of Sacramento Neighborhood Services for the 2018 job fair coming up next spring. And also to elaborate on this movie night event, this is not our main idea, but is one of our most prominent, what we have so far. And we have recently found companies that provide like a blow-up screen and speakers and provide food for around 100 people. And now we're focusing on choosing a date in either late June, July, or early August to choose in like the Arden Park District, Fair Oaks District, or the Cordova District. So right now we're focusing on getting a location, and then from our location we can move forward from there.
Okay.
Great.
Very good.
Thank you.
I hope you get 1,000 people like we did in Foothill Farms.
Well, this is great. I know we got supervisors want to weigh in, and before you all leave, we'll get a picture with all the supervisors after we get done with the questions and comments here. So Supervisor Cerna, Supervisor Frost, I trust Supervisor Peters, and myself will all weigh in here. So.
Thank you. So first of all, thank you for your service. You're all very articulate young people, and speak very well about your ambitions and your service in the last year. And I know we always appreciate having you here in Chambers to hear firsthand what you're up to. Some of us on this board, I think it's fair to say, during what's called National Night Out, are circulate. This is one night a year. It's the first Tuesday in August, where typically we'll be circulating to various neighborhoods within our districts to meet with our constituents. And this started several years back as a way for communities, neighborhoods to get to know their law enforcement personnel and agencies. It's since expanded to become much more than just limited to law enforcement. It's really, I think, now a celebrated national event on a single day where neighbors come out to meet one another, in addition to law enforcement and the public safety personnel. But one of the things that I'd like to plant a seed with you about is one of the bullets you put up there in terms of community events. I don't go to several neighborhood events any longer on National Night Out. I'm now hosting one, and we do it at Jack Davis Park. It's in the South Oak Park, Ridge Pocket neighborhood of the district I represent. It's in the unincorporated county. And for each of the last 2 years, we've had several of our county agencies represented by various personnel that have information booths, tables, whatnot at the park. Certainly we have our Sheriff's Department, our Probation Department, and the Sacramento Fire Department. But we also have Child Protective Services, and we have Solid Waste and Recycling, and we have Animal Care and Control. I think it would be great, if you're willing to do it, to add to your list of community events to join me and my staff, but certainly several dozen of our county agency staff on August 1st, Tuesday, August 1st. And it's a couple hours. I believe it's 5:30 to 7:30, roughly, to have the Youth Commission actually staff a table there and maybe reach out to the families, and there's always lots of young people at this event, to reach out to them to let them know what you're up to and perhaps inspire their future service on the commission. So that's an open invitation. And if you're interested, you can speak with my staff who would be happy to coordinate with you.
Okay, good. Thanks for that invitation. Supervisor Frost and Supervisor Peters.
I wanted to thank you for your service also and for your leadership. And I have a question, and it relates to your commitment to the Youth Commission. Is there a large time commitment? Do you meet often? Where do you meet? And how do you get there? Do you all drive? Do most of the folks that are on the Youth Commission drive to the meetings? And do you find that to be a challenge with all your school activities as well? I'm curious because I want to see if I can get more people from District 4 to get involved, and I want to promote that. I think it's a huge opportunity to learn more about leadership and about local government. But I wondered if you could tell me a little bit about your activities on the commission.
Sure. So we meet monthly. So we have 12 meetings a year, and then we can call a couple special meetings in between there if we need to for certain events, before certain events. And our meetings are actually here on the 7th floor at 6:15. So it's pretty late, but I don't think it's an inconvenience. I would say that it's sometimes difficult with school and stuff, and other extracurriculars, but I'm the first one to say that I really, really enjoy it when we do meet, and I think they would say the same, because our meetings are pretty fun. So, and they're generally not too long, but they are kind of late, and we're actually looking right now to see if we can meet more often, whether that's twice a month or even every 3 weeks or something like that, because we are finding it difficult to keep things moving with only meeting once a month, because we do have subcommittees for certain events and that are dedicated to some of our projects that we're doing, but it's hard to keep the ball rolling when we're only meeting once a month. So we're looking into that right now to see if all of us would be in favor of doing that and what that would look like, what it would mean for us, stuff like that. And as for the driving, I got my license yesterday morning.
Oh, wow.
I'm 17, so pretty late to the game, but I think some of us do drive to the meetings. I don't think any of us carpool, but some of us drive to the meetings. Some have our parents drive us. Is it difficult for any of you guys? I don't think it's too hard to get there.
That's a commitment. That's a big commitment.
It is, yeah.
Thank you for all you guys do. Yeah, we enjoy
You all
it.
can come up too. I mean, if you want to answer the question too, because it's kind of,
So Supervisor Frost, Alma Muniz from County Exec's office coordinates this. She's also responsible for the agenda, but she takes this role on once a month. And one of the things that we've been discussing is that if it's more convenient, we do have facilities at Bradshaw too. If that's more central, 615, less traffic, we can make conference rooms available there too. So as they're looking at the frequency of it, it could be one downtown, one at Bradshaw. So we'll reconfigure that as need be on that.
There's Hazel Avenue. There's other
Hazel,
county facilities.
Hazel, the only thing we worry about is with District 5 with some of the folks coming out of Elk Grove. That is
it's a
nice
long ways.
Bradshaw was a little bit more central for all the districts. So that was our thought process. We haven't quite gotten it to a mature point, but we're working on it.
That's really great. Well, thank you for your service.
Yeah. Thank you. I hope you enjoyed your year. It sounds like you did, if you want to meet more often. I wanted to ask you all to come up and tell us where you go to school.
So I go to school at Sacramento Country Day School. I don't know if you guys have heard of it.
On Latham?
On Latham, yeah. It's a small private school. Very, very small, but I like it there. So, good.
I'm a sophomore at Rio Americano High School.
Right.
I'm a 7th grader at Sutter Middle School.
Wow.
Wow.
Okay, the three of us all go to Mira Loma, but I'm a senior and they're both sophomores.
Very good.
Oh, not that you're rubbing it in. You can come up anyway and say your name and where you go to school.
Okay, I'm Matthew and I'm a sophomore at Miraloma.
Yeah.
My name is Luke, and I'm a sophomore at Miraloma.
Yeah, we see Miraloma in here a lot when you're winning science fairs and other academic ventures, so that's nice. And I walk my dog by Sacramento Country Day every day, so, and right where you are. Yeah. Thank you. Thank you all very much.
Thanks.
Yep, I just wanted to add the comments while you're up there. I said we can get a picture in a moment. Certainly to thank your advisor and person that helps keep things together to glue. Thank Alma Munoz for her work. Alma, you want to stand up and be acknowledged? Thank you so much. Again, you've taken this on very seriously, and I know that you brief. Yeah, I think we give you a round of applause. And again, you young people obviously are very bright and outgoing, and I think certainly bring a lot of energy to your efforts. But having a strong advisor and someone who provides that level of connectivity with the county organization is really important. But I want to just compliment you again. I'm very impressed, as I have been in the past, with our youth commissioners and certainly your interest. And you're very well spoken, but you, I think, have captured a variety of things throughout the course of a year, have come together as a group, and it's kind of bittersweet to see some of your members go on. But obviously, you got someone like who's. If you'd asked me if you were in the 7th grade, I'd say, that can be so, and so I think that continuity, though, building that over the course of over several years on the commission, and your interest in doing good for your community is really, really commendable. I would just say too that as you have events, we may be on your mailing list, but as certainly representatives for 5 supervisorial districts, but throughout this county, you can put us on your list when you're having an event. I mean, obviously, we're coordinating a movie night in District 3 or District 4. You would invite the supervisor of that area, but as you're having fundraisers, you're trying to raise money to buy a minivan for Mustard Seed School or get subscriptions for, food baskets and so forth. Again, we're always, available to certainly be coaxed into trying to support it one way or the other. And it may not be financial. Maybe that we know someone and or have connectivity with others who might be able to assist. And I think that's part of the strength that we have with you as young people, but certainly with members of this board. And so I would encourage you to at least keep us on your list as far as it relates to your events and activities. And feel free to invite us to participate as you see fit. So, but I want to just commend you. I mean, it's you've had a busy year, and hard to believe we're zeroing in on June already. But obviously, some of you will continue in your efforts, and look forward to hearing more good reports as you go forward in the months to come. So, Supervisor Cerna.
Yeah, one last thought, Mr. Chair. It might be good if the commission might give some thought to, if you don't already do this, is to routinely scanning the agendas that for our meetings. For any issues, whether they're on what we call the consent calendar or a time matter that are related or somehow associated with youth. in Sacramento County. And if you're doing that, maybe you want to share how you're doing that, or any kind of processes that you've actually implemented for yourself.
Yeah, so in every single month in our meetings, one of us every month go over and we look online and we read through one of the agendas on, so for example, last meeting I looked up on your May 9th meeting, and so we would pick out some of the stuff that you talk about that relates to youth. So for example, I picked out something you talked about gathering funds for children mental health facilities and getting a pool of money for that. And so every month we do look over your agendas and we talk about them and how they relate to us.
Great.
Very good.
Thank you.
If you see an item that really captures your interest, that you want to tell us what you think about it in advance of us making a decision, that would be good too. So, sorry.
No, I was getting up to go take a picture.
Let's go take a picture. All right, ready? Let's take a photo.
Come on over here, up right in front of you.
You have the best hair award. Thank you.
You stand in front of us. Ready? Set. Okay, got a few.
Thank you.
And thanks to the parents. I think maybe we have something here too for your support, and if you're doing some transporting, that's always great too. So we appreciate the support. You bet. Well, that's a very good note to nearly draw the meeting to a close, but we have appointments and I think a couple of adjournments. So.
Okay. Item 85 are your nominations. You are continuing to June 6th, the Sacramento County Youth Commission. You're continuing to July 11th, the Assessment Appeals Board, Consumnes Area Community Planning Advisory Council, Disability Advisory Commission, Fair Oaks Cemetery District, and the Sacramento County Alcohol and Drug Advisory Board. And for your matters today, Adult and Aging Commission. Mr. Natoli?
I left the list. If you have the list, my list, I took it out with my stuff in the afternoon.
Patricia Waite to the general seat. Is that
that's fine. Go ahead. I don't have it, so I'm going to rely on one of you.
The chiefs recommend Patricia Waite to the general seat and continue the remainder to July 11th.
We're not the vice chair. She can read them in because I don't have my list in front of me. So go right ahead, Susan.
Okay. For the next matter, Carmichael Old Foothill Farms Community Planning Advisory Council.
Yeah, I'd like to nominate Roxanne Stillmacher and Nicholas Blosay to be on the CPAC.
Next would be the Children's Coalition.
The chiefs are recommending Chandra Stewart and reappointing Angelina Woodbury to the public consumer seat and continue remainder to July 11th.
And then the Sacramento County Mental Health Board, Supervisor Cerna, show that you're continuing to June 6th.
Yeah, for both the family and public interest vacancies.
And I do have a note for Supervisor Kennedy that they are making that appointment. Does that match your records?
I just haven't, it's a blank. I don't think we know, so.
Okay, I received...
If he's sending you a note, then go with it.
I got confirmation from District 2, and I worked with your district chairman.
Okay.
Okay, and then for Supervisor Frost?
Sacramento County Mental Health Board, continue to June 6th.
Okay. And then that concludes your nominations.
Okay, very good. All right, we no other order of business. We continue our closed session to tomorrow. We've got supervisor comments and county executive. I have at least one adjournment, but we have any items that are falling off the agenda tomorrow. We'll have a very full afternoon. All the items are on for tomorrow's agenda. So we are going to have a little bit of a compressed schedule with the addition of the closed session. So.
Correct.
All right. Okay, with that, then let's go to board member comments. Mr. Stern? Oh, I guess we'll go to you first. Well, we'll go to you first.
I'm good. Wait till tomorrow.
All right, Susan,
Yeah, I would like to shout out a special thank you to Officer Sergeant Steve Harding, who is at the Kenneth Royal Firearms Facility in Elk Grove. My District 4 team went on a team building retreat last week, and we spent the day doing some things, and we started out at the firearms facility and we did some simulation activities, and Sergeant Harding helped us along, and it was a lot of fun, and it was very it actually helped us see through the eyes of the officers who are responding on the streets in situations, making split-second decisions on very difficult scenarios, and it gave me a new outlook. I found out I live life through rose-colored eyes, and I don't always see things maybe the same way. And it's not that easy sometimes to make those quick calls. So thank you, Sergeant Harding, and the Sheriff Department for helping us with that fun activity. And that's all I had. I just wanted to thank them for helping us out.
Okay, thanks. Yeah, something else?
No, I'm good.
You didn't change your mind?
No.
Okay. All right. I don't have any comments, but I do have one adjournment that I'd like to call attention to here today. And I know, I think Supervisor Peters and Cerna would recall that a couple of years ago we had a lady by the name of Ruby Lee Allen Graves who was celebrating her 100th birthday, and we recognized her here in these chambers back in 2015. She passed away a couple of weeks ago, so I just want to read from the obituary that appeared in Sacramento Bee. Pretty amazing, and it's abbreviated segment here, but she was the seventh child of 8 children born to Stub Allen and Maddie Munford Allen in Dublin, Georgia, on February 17, 1915. At an early age, she had an urge for reading, was intrigued by world events, and I think she actually commented on that, that she self-taught herself to read, and she followed political goings-on, but certainly events as they unfolded throughout her lifetime, starting obviously when she was a very young child, the conclusion of World War I, and running through the very recent times. She was employed as a housekeeper at the Pick, Ohio Hotel. She moved to Ohio in 1937. Following her retirement, she worked in her community, was very involved in her church, as we heard, and was known affectionately by many as grandmother and certainly a mother. I think one of the things that really was astounding, though, was that her family, her extended family, she had, I believe, 11 or 12 children, and then the numbers go off the charts. And she talked about this a little bit when she was in these chambers. She had 70 grandchildren, 196 great-grandchildren, 163 great-great-grandchildren, and 7 great-great-great-grandchildren. And obviously her family was very much a focal part of her life. We had a chance to meet some of her sons and daughters and some of the grandchildren, and I think even a couple of great-grandchildren that were here in the audience. And I don't know, I was just very impressed in her, said that her passion in life and motto was to keep in framework that sometimes people do things they really can't help it, but that you can help others in what you do in your life and how you live it. And she had summed up, and I don't recall her saying this, but it was reported in the paper that her desire was for her old days to be her best days. And if she lived to be 102 years old, obviously she lived a very long life, a very fruitful life, one that will be remembered by people in this community and throughout the communities in which her children and her large family reside. So at any rate, I just wanted to call attention to that. We had a chance to honor and recognize her one day a couple of years ago, and I wanted to adjourn today in memory of Ruby Graves, who passed away at the age of 102. So with that, any other adjournments? If not, then we will stand adjournment until tomorrow at 1:30. We come into closed session.